Hi, it's Dr. Lisa Watson, Toronto-based naturopathic doctor, and today we're talking about how to choose a naturopathic doctor. As a naturopathic doctor, one of the most important things that I find is making sure that I'm a good fit for my patients. I'm not the right doctor for everyone, but I do believe that most everyone can benefit from having a naturopathic doctor as part of their team. So today we're going to talk about those things I want my patients to ask me and other prospective naturopathic doctors before they embark on this health optimizing, life-changing relationship. We're going to start with the basics. The first question I want anyone to ask when they're meeting a naturopathic doctor for the first time is, do they have a degree? Naturopathic doctors receive a degree from any number of different schools around North America. There are 2 here in Canada and a number of them in the States. Each will provide that individual with a degree in naturopathic medicine, or an ND. Be sure that your doctor has this designation if you want to work with them. The next thing to look at is, what is their license? More specifically, are they licensed to practice where you live? Not every state and province regulates the practice of naturopathic medicine, so doctors can practice, or lay people can practice, under the heading of a naturopath without actually having a license to do so. I'm licensed to practice in Ontario, so most of my patients live here in Ontario. If you live outside of Ontario, reach out. I'm happy to help you to find a naturopathic doctor who's licensed to work where you live. The next thing that we want to look at is making sure that the doctor has the right fit. I want to make sure you're with the right doctor for you. The first thing that I encourage people to ask a doctor that they're considering working with is, do they have a practice focus? Naturopathic doctors are trained as primary care practitioners. That means that we're trained to help everybody. But most practitioners, most doctors develop a focus in their practice, a population that they love working with and have a great depth of knowledge in. My practice focus is women's health and hormone balances. I do a lot of work in thyroid conditions, period problems, issues with perimenopause and menopause, and I have a special interest in multiple complex hormonal imbalances. When women have issues of stress hormone imbalances and thyroid hormone imbalances and perimenopause, those are the people I serve at my best. We also want to look at whether or not this naturopathic doctor has any additional training. Do they have additional training in things like IV micronutrient therapy, bioidentical hormone prescribing? Do they have the ability